This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
By now, you may have already heard of the ALS Ice Bucket Challenge, a viral philanthropic social media campaign that involves dumping a bucket of ice water on someone's head to raise awareness about the disease, amyotrophic lateral sclerosis. This widely popular activity encourages donations for research of the disease, with many big names joining the fray, such as LeBron James, Justin Bieber, Bill Gates, among many others.
ALS is amyotrophic lateral sclerosis. Amyotrophic meaning lumiliit yung mga muscles natin, nagkakaroon ng atrophy. And lateral sclerosis means it's affecting a specific part of the spinal cord. Isang term dun sa ALS is called motor neuron disease.
ALS is a progressive neurodegenerative disease that affects nerve cells in the brain and the spinal cord and can lead to total paralysis.
Ang unang-unang mararamdaman ng mga tao is panghihina. Panghihina dun sa iba-ibang parte ng katawan. Maaring nahihirapan sila sa paglalakad, madaling madapa, napapansin nila na lumiliit yung isang bahagi ng katawan. Usually, asymmetric or yung hindi pantay yung pagliit ng isang bahagi ng katawan. At ito ay walang kasamang sakit, hindi kayo makakaramdam ng pamamanhid, so panghihina lang talaga.
It usually affects people between the ages of 40 and 70, with various early signs and symptoms that include weakness in the feet, hands and legs, twitching, muscle cramps, and difficulty in walking and doing other regular activities.
As of now, wala pa pong cure for ALS. Pero we don't really talk about cure. We talk about management.
There is currently no cure for ALS, but the recent support by people all over the world through the Ice Bucket Challenge, together with other initiatives, have been big and important steps for people to know more about this debilitating disease.
How common is ALS in the Philippines? How is ALS diagnosed? Find out the answers tonight on MedTalk. And joining us tonight is Dr. Paul Pasco, neurologist of the Philippine Neurological Association of the Philippine General Hospital, Department of Neurosciences. Also with us is Dr. Alejandro Diaz, consultant neurologist at the St. Luke's Medical Center, UST Hospital, and San Juan de Dios Hospital. He's also a member of the Neuromuscular Council of the Philippine Neurological Association. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Bimbo, Dr. Paul. Welcome to MedTalk.
Good evening, Jake.
ALS.
Angel.
Yes,
Yeah.
doctor. ALS, amyotrophic lateral sclerosis. What is ALS? Let's start with you, Dr. Bimbo.
Yeah, ALS or amyotrophic lateral sclerosis, meaning to say amyotrophic, lumilit yung muscle. Eventually, gradual progressive wasting and weakness of the muscle. And the lateral sclerosis, because that part of the spinal cord, which we call the corticospinal tract, coming from the upper motor neuron from the brain, also degenerates. So it's actually a combined degeneration of the upper motor neuron coming from the brain, yung pinaka-boss that tells our muscles to move, and then tells the neurons in the spinal cord, the lower motor neuron, both of them degenerates eventually. They die gradually, progressively, leading to weakness of the muscle and wasting, atrophy, fasciculation, eventually affecting the ability to speak, to talk, to write, to use your hands, to walk, and later on they become bed-bound, wheelchair-bound, and then bed-bound.
So just with that information, it's overwhelming to understand and to absorb what happens to our body once one is diagnosed with ALS. As you've mentioned, no, the muscles degenerate, and so does the nerves. Isn't that right, Dr. Paul?
Yeah, it's the nerves that degenerate first, the motor neurons that die down first, and then later on, because it's the neurons from where the muscles get their stimulation, so later on, the muscles also die as well.
When you say die down, how does this happen? What happens to a person's body when the motor neurons and the nerves, the muscles start to die slowly?
Well, there's progressive weakness. As Dr. Diaz mentioned earlier, there's progressive weakness of all the voluntary muscles. So it depends which muscle group is affected first. For some, it's the upper extremities that's affected first. For others, it's the lower extremities. And then for yet others, it's the bulbar muscles, meaning the muscles that control swallowing and speech, and even respiration, which are affected early on. So it really depends from person to person which muscle groups affected first, but eventually, later on, all of these muscle groups are affected, and there's really progressive weakness and wasting of a person with ALS.
How common is ALS in the Philippines? We just recently learned more about it via the Ice Bucket Challenge, which has gone viral. And as mentioned in the video, it's for ALS awareness. So here in the Philippines, how common is ALS, Dr. Bimbo?
I would say that prevalence-wise, we don't have an available local data as to how many per 100,000. But in the US, they have statistics of 1 to 1.5 per 100,000 population. So compared, for example, with myasthenia gravis, which is 1 per 10,000, it's not very common also, compared with other neurological diseases like strokes, neuropathy. So ALS is not that common. So the same thing here in the Philippines. But since I think it's a very devastating degenerative disease which does not have a treatment, so this is very how important it is to understand the disease so that we can find out how to really find eventually a treatment that can actually delay or even probably improve the condition. But for now, the only available prescribed drug that we can give to our patient only delays the condition in a very short period of time, just a few months. If we follow that classical ALS prognosis, usually they live within 5 years. But those who develop ALS at a younger age, they seem to live longer. Okay. Like, for example, you know, Stephen Hawking, that theoretical physicist, he was diagnosed to have ALS at age 21. And his neurologist then gave him, you know, just a few years to live. And now he's, I think, 70 years old, just turned 70 or about to turn 70. And
Around that age,
still alive. So many years back, we thought that ALS is just one for everyone. We now know it's a very heterogeneous disease. It has many classes. In 2006, because of the gene, the understanding of the human genome, we now understand that certain proteins that are misfolded, which eventually kill the neurons, there are many subtypes of ALS. But the clinical ones that we see, as Dr. Paul has mentioned, there are probably around 3 or 4 manifestations of ALS. One is the classical sporadic ALS, which usually starts at age 40 to 60 and lives around 5 years. But there's also the younger one, the juvenile ALS, that starts around 21 years old, before 25 years old, you can consider ALS, juvenile ALS, and they live longer. Some of them live 30, 40, and even Stephen Hawking, he's the outlier, I would say. He's living beyond 50 years, okay. And we have the familial type of ALS, meaning genetic, pamilya sila.
Oo, yung na-pass on na yung gene na yun to the other
it's
family
about
members.
10%. And there's the other one, which we call the progressive muscular atrophy. This one, di ba sabi ko may upper motor neuron, lower motor neuron. The ones that is variable are mainly the lower motor neuron. And there's another one, which is seen more in their 50s, the primary lateral sclerosis. Only the upper motor neuron are mainly affected. But in general, almost all, and there's another one, the progressive bulbar palsy, wherein it affects at the start the speech, the eating, so you know, they'll lose that before it involves the respiratory muscles. But all of them spares the neurons involved in sensation. It spares the neurons involved in memory, in judgment, in thinking. So that's the for now the challenge. Why does it only attack the motor cells? Why does it spare? So that's why until now we don't still have a cure, because scientists has not really fully understood yet why it only involves the motor cells. There are now theories that, as I said, there are certain genes that only attack that. Only the motor cells.
They choose to attack only the motor cells.
And these genes are many genes.
Yes.
They have discovered the superoxide dismutase gene. Okay, they have discovered the synataxin gene for the juvenile ones, and there are some more. So I think this is very good because of the researchers, the scientists and researchers, even non-neurologists are going into that, looking into the cellular levels. They're now are able to better understand the pathogenesis of this why do the motor neurons slowly die eventually.
Okay. So more research that goes into understanding ALS, and because of the Ice Bucket Challenge, and it has raised a hefty number, a good number of a large amount, Dr. Paul, then this amount will go to further research of ALS.
Yes, it should go to further research, but I think it should also help. It should go toward helping patients and families with this condition, because it's really a very devastating condition to have. So I think it should also help these patients afflicted with ALS.
You mentioned family and other members of society that might be affected or already are already suffering from ALS. Is there any gender preference when one is diagnosed with a disease, or who is most likely or more likely to be affected with a disease, Dr. Paul?
One of our doctors in PGH did research on ALS using local data, and her data showed that there were about almost twice as many males as females, 1.7 males to 1 female. So there are a bit more males affected than females.
And is there any explanation? Has there been research done why the males are more
Just
affected
theories,
than females?
because some risk factors that have been proposed are those that have to do with, say, certain risky occupations like farming, pesticide exposure, or smoking. So those are just theorized risk factors, but there's still nothing definite.
You mentioned the risk factors. Doctor, you've mentioned the types of, or the variations of ALS. We'll talk about the symptoms of ALS when MedTalk returns.
Did you know that ALS is also known as Lou Gehrig's disease, after the popular baseball player who was diagnosed with it? Gehrig, who played for the New York Yankees for around 17 seasons, was known for his durability and hitting proficiency, which later on earned him the nickname the Iron Horse.
We're back here on MedTalk, still talking about ALS. You may join the discussion by calling our hotline at 548-4678. Doctors, before we cut to the break, we were talking about risk factors and variations of ALS. Now let's talk about the early symptoms of ALS. Dr. Paul, let's start with you.
Weakness is an early symptom. Aside from weakness, patients could experience twitching of the muscles, or they could also experience cramps or painful contractions of the muscles. So it's all still muscular symptoms, weakness, cramps, and twitching.
Are these symptoms brought about by any activity? Or even if you're still, it can happen? You can experience it?
It can be brought about by activity, but it can also happen when the patient is resting.
Okay. And because of the feeling of weakness, is there a particular body part that is affected first? Is it the upper part, the lower part?
It varies. Some can have the upper extremities affected first, so they have weakness with their grasp, with holding things with their hands. Some would have problems with walking, with putting on their footwear, and then others would, although this is the rarest, others would have problems with swallowing or with speech or with breathing.
Dr. Bimbo, can we mistake these symptoms for another neurodegenerative disease?
Yes, yes. I would probably say it this way. In the fully developed ALS, for us neurologists, it's not difficult to diagnose.
Okay.
But the challenge is actually in the beginning, say, in the first year, when the symptom is very non-specific. It can be just some difficulty in, using buttoning, using the car keys, things like that. Or when you walk, you easily trip, natatapilok, and things like that. So, cramping, and then nagfa-fasciculate na, for example, na ganun. But you can see this also in other conditions.
Yes.
In fact, many of my students sometimes, Doc, mukhang mayroon yata akong ALS, kasi may mga nagtitweets. So it's not that. It's
okay.
The thing is, it's more than the normal. More than the normal. So eventually, when you take the history of these patients with ALS, say 2 years back, ganito na nag-umpisa, and then later on, it progresses up. Okay. Usually from the most distal part. If it is, as Dr. Paul has mentioned, predominantly upper limb onset. There's also lower limb onset, and there's also the cranial nerves onset. So depende. So, but the important thing is it's not sudden. It's very gradual and progressive that leads to the slow death. Because eventually, the pathophysiology is the brain cells undergo what we call programmed cell death or apoptosis. And when these cells stop to function, the signals coming from the nerves eventually are lost. And the muscle will eventually lose its ability to contract. And eventually they degenerate and atrophy.
Okay.
Yeah. So in some conditions, like for example, spinal cord diseases, they also can have symptoms and signs that looks like ALS, but it's not ALS.
Okay, so it's really best that if you feel something that is not normal, you know, and you're not able to function or you're not able to perform your daily activities, it's best to consult your doctor. Doctors, we have a caller on the line. Marjorie. Hi, Marjorie. Good evening.
Yes. Hello po.
Hi, Marjorie.
Good evening po.
Good evening.
Good evening.
Please go ahead with your question.
Tanong ko lang po, kasi po masakit po kasi yung likod ko pagka naglalaba po ako. Tanong ko lang po, kasi diba nakarinig ko po kanina, around merong early po na 21 to 25. Tanong ko lang po kung ALS na po ba, kasi minsan po kasi pagkagabi din po, nagigising ako sa madaling araw. Yung buong braso ko po sa kaliwa, namamanhid po siya. Yun po.
Okay, salamat, Marjorie. Dr. Paul.
Hindi naman kasi karaniwan na magkaroon ng pain, ng sakit, Lalo na halimbawa, sabi niyo naglalaba kayo tapos sumasakit yung likod. So malamang baka low back pain lang ito dahil sa dahil sa pagtatrabaho ninyo. No? So, palagay ko hindi naman ito ALS kasi hindi naman karaniwan na magkaroon ng sakit sa katawan sa ALS. Ang mas nararamdaman ng isang taong may ALS ay panghihina.
Panghihina po talaga.
Oo.
Sige po.
Okay, Marjorie, may tanong ka pa for our doctors?
Kasi po, nanigarilyo po kasi ako. So, at ano ko rin po kung dahil din po sa paninigarilyo ko, kaya nahihina rin po yung muscles ko. Lalo na po yung pananakit. Okay.
Okay, Marjorie, hindi namin masyadong naintindihan. Oh, okay. You smoke. Naninigarilyo ka, no, Marjorie? Okay, so may nararamdaman ka referring to yung paninigarilyo at saka sa sakit ng likod?
Napapagod.
Pag napapagod. Well, smoking.
Hindi ko po kayo naririnig kasi nakamute po yung TV ko. So, sa phone ko lang po talaga kayo naririnig.
Okay, so madali kang mapagod. Well, prior to that, she said she had back pain when she
does the laundry.
does the laundry. Now, smoking. And accompanied by panghihina, because we've mentioned weakness. So that was her follow-up question.
Siguro, ang pwede natin sabihin, hindi natin alam kung exactly kung anong meron siya sa ngayon. But one thing that we can say is that hindi siya ALS.
Okay.
Kasi ang ALS, walang manhid.
Okay.
Siya may namamanhid sa kanya.
Yes.
At kadalasan, as Dr. Paul has mentioned kanina, walang pain. Sa kanya may pain. So, yung kaya naramdaman, there's another condition. We cannot say, hanggang di namin na historya mabuti ang pasyente o ma-examine, we cannot say what it is. Pero sa istorya niya, hindi sa ALS.
Okay, so
Kasi talaga ang
salamat for
ALS, progresibong panghihina ng isang parte ng katawan, lumilipat eventually sa isang parte ng katawan, at halos eventually, sa susunod na mga buwan, halos lahat ng katawan may involved. Humihina, lumiliit. Okay?
So tapos, lumiliit?
Yes. Tapos pag chinek mo yung mga reflexes nila,
okay.
Kaya in the video, yes, nagiging hyperactive.
Okay.
Yan ang karakteristik ng ALS. So yung triad, weakness, atrophy, hyperreflexia, pag nakakita ka naman yan, yun ang una may iisipin. So usually, yung neurologist, i-refer yan dun sa electromyography test.
Electromyography test.
So it's a test na tinetest ng muscle and nerve para malaman kung ito nga ba ay nagpo-fulfill ng criteria ng ALS. Okay? So it helps a lot. So yung clinical diagnosis ng neurologist plus yung EMG and CB or electromyography will help narrow down kung hindi ito ALS. Ito malamang ALS. Ito possible ALS lang.
Okay.
Like for example, I have a patient 5 years ago na
ano yung symptoms ng patient na yun?
Humihina rin siya. Pero nung examine ko siya, hyperreflexic. Okay. Pero nung ini-EMG ko siya, wala pa akong nakitang involvement ng lower motor neuron. Kasi ang ALS, dalawa yan eh. Upper motor neuron, yung galing sa brain, lower motor neuron, yung mga nerves galing sa spinal cord. Sa kanya, hindi na-involve yung mga nasa spinal cord yet. But 5 years later, tumawag sa akin yung mother na mukhang ALS. So pinadala ko siya sa hospital at ini-EMG ko siya. And tama si mother niya na fully developed na. So it's now amyotrophic lateral sclerosis. Kasi meron kasi kami pinapalo na criteria. Sa aming mga neurologists, we know yung tinatawag na L. escorial electrodiagnostic criteria para sabihin namin na ALS to. Kasi mahirap mag-ano. Mahirap na sabihin mo, mali pa ng diagnosis mo. You're giving a diagnosis to somebody na at this point, walang cure.
Like you've mentioned, your patient came to you without the other characteristics of ALS.
Like for
After
example,
5 years.
I've seen a patient na nirefer sa akin mukhang ALS daw. Nung in-examine ko, in-evaluate ko, Parkinson's disease. Nung binigyan ko ng gamot for Parkinson's, gumaling. So nawala na ganun. So tuwan-tuwa siya, hindi sa ALS.
You mentioned Parkinson's. What are the similarities between Parkinson's and ALS, Dr. Paul? Just for the information of our viewers as well.
Actually, not many. In Parkinson's disease, the problem is tremors. It's a specific kind of tremor. It's the pill-rolling tremor. So it's different from what we see. Some patients with neuromuscular problems will can have fine tremors or twitching. And then Parkinson's patients have rigidity or stiffness. ALS patients don't have rigidity. They usually have just weakness or flaccidity. So there's not very many similarities with ALS and Parkinson's.
Is ALS reversible? Given treatment, you've mentioned treatment, and then if diagnosed with ALS, can you reverse?
Just slows the progression. As Dr. Diaz mentioned earlier, we have medications like Riluzole, but it only slows the progression of the disease. It doesn't reverse the illness. It's not a cure for ALS.
So, as you've mentioned, there has been no cure yet for ALS. The best one can do is that when you feel all these symptoms and it debilitates you.
I think we have to really understand that many diseases, especially in neurology, at this point don't have a cure yet. But there are symptomatic treatment that we can give to the patient to make them more comfortable, to avoid complications. Like, for example, in ALS, for as long as you can prevent them from developing respiratory failure, say, refer early to pulmonary specialists to have a good pulmonary support. For those who start to have difficulty in swallowing nutrition, refer to a good nutritionist, to physical therapy, to occupational therapy, to teach them how to swallow, to teach the family how to prepare the food. And for those who cannot really swallow already, to suggest an early tube feeding or just put a tube in the stomach. This will definitely prolong because it's the respiratory failure, it's the inanition and malnutrition that eventually kills the patient. So if you can address this, I believe that you can actually somehow delay or prevent early death of these patients.
How about, before we cut to the break, you've mentioned swallowing, that you can do tube feeding if the patient is having difficulty already. There are therapies that can be done to make the patient comfortable. Since it's nerves in the brain, does it also lead to an impairment with your thinking or with cognitive skills? Does it lead to that as well?
No, it doesn't affect, ALS doesn't affect cognition, it doesn't affect intellectual function. So that's a tragic thing about ALS, because patients with ALS, even though they're weak, they're wasting, their minds are intact.
Okay, and they're able to communicate.
Yeah.
No? Others are able to communicate how they feel and how they prefer to be comfortable. Is that right?
Yeah, I would probably, of course, again, as I said, Stephen Hawking, the best known living ALS,
Yes.
has a very positive outlook.
Yes.
And as I said, he took the challenge from his neurologist then,
Yes.
that I'm going to live long. And he was one of the early recipients of SGD.
What is SGD?
A speech generating device.
Oh, yes,
that computer thing that is,
Yes.
makes him talk.
Yes.
That's not his voice, actually.
Yes,
But he's able to do that. And you can see that he has 24-hour care. And I think these are all important things that if you really care, avoid complications, contractures, all of those things, you can actually prolong life.
Doctors will talk more about ALS, will understand more about ALS, and educate our viewers more about ALS when MedTalk returns.
ALS is a disease that alters the function of the muscles and the nerves. For 50-year-old Jacqueline Suralbo, the discovery that she had the disease happened just last August 11 after a hospital checkup at the Philippine General Hospital.
Mabilis na akong pulikat, Tapos yung mga lamang ko, gumagalaw, muscle, dito sa kamay ko, daliri ko, bumaluktot na. Tapos yung nakita ko lang, yung muscle ko dito, lumubog.
While the disease may begin in your hands or feet, it can quickly spread to different parts of the body.
Ang sabi ng doktor, yung nga, nung nalaman ko na may ALS si ate, nanghina ko, syempre, pero natuwa din kasi nalaman na namin talaga kung ano yung sakit ng ate ko. Ang sabi ng doktor, walang lunas ang ALS na yan. Sabi niya gana, ang gagawin nyo lang, be positive, laging awareness, pagandaan nyo kung anong dapat gawin sa ALS na yan.
For the past couple of years, Jacqueline could not walk and was simply confined to their house in La Union. Today, though she can still eat by herself, she's highly dependent on family members on the many aspects of her life.
Ayun, pinapakain namin siya ng masustansyang pagkain, vitamins, tsaka ang pagkain niya ay malambot na dapat kainin. Iwas nga sa bilaukan, lahat ng hindi pwedeng mangyari, ginagawa namin. Kailangan malakas kami magkakapatid, malakas ang mga anak niya, malakas si ate. Malakas si ate. Ang ate ko, ang lakas din namin.
We're back here on MedTalk, still talking about ALS. Also joining our discussion tonight is Mr. Leonard Malyari, an advocate of the ALS awareness in the Philippines. You may join the discussion by calling our hotline at 548-4678. Hi Leo, welcome to MedTalk.
Good evening.
Good evening. Dr. Paul, Dr. Bimbo, Leo.
Good evening.
Yeah, we met earlier.
Yes, we met earlier. Let's talk about the case study, Jacqueline. Her condition now that she's able to walk, she's able to tell her story, she's able to share her story. Is she a typical ALS patient, Dr. Paul?
I didn't catch, when did her symptoms start?
2011, just
3 years ago.
I think 3 years ago. Or she was diagnosed with ALS. I think the final diagnosis was just last August 11.
Ah, okay.
Yes, the final diagnosis. So.
Yeah, if you look at the video, you can see the weakness, the atrophy of her arms and her hands and her lower extremities. So it's typical. And you can see that she has difficulty with swallowing, so she has to have mechanically soft food. Mm-hmm. So that's typical of our patients with ALS, mm-hmm. weakness and difficulty swallowing.
Mm-hmm. With her medication and proper nourishment and the support of her family, she will be comfortable.
Yes, hopefully.
Hopefully with carrying on, knowing that she has this disease. Dr. Bimbo, would you like to add to
I agree with Paul. I was looking at the video and she has a combined symptom and sign of upper motor neuron when she was walking, stiff.
Okay.
That's what we call in neurology spasticity.
Okay.
Spastic gait. And then the wasting of the hand muscles, those are atrophy, characteristic of lower motor neuron. So she has both upper motor neuron and lower motor neuron disease without sensory symptoms. So this is very characteristic of ALS. And how old is she now?
I didn't think. How old is she now? She's 50.
So that's about
50.
Okay. The classical ALS usually starts around 40. It's a disease of middle age to elderly. 40, 50, 60. As they get older, the higher the risk. Okay. And then, supposed to be more progressive. The biology of classic ALS is a little bit is different from the ones who start younger.
Yeah. Okay. Leo, you're part of ALS Philippines, and I understand you manage the page, the Facebook page of ALS Philippines. Do you have a family member who has ALS? That's why you started the page.
Yes, I did.
Okay.
Yes, I started the page initially because of my aunt who was diagnosed with ALS back in 2012.
Okay. So 2012, she was already, that was the final diagnosis?
That was the final diagnosis, but the symptoms of ALS manifested on her back in 2011. So initially we thought that she had mild stroke, and then pinatingnan namin siya, and then the doctor back in their place asked us if we could go to Manila for, I think, a second advice, because she diagnosed her with ALS, but she wants to make sure, so she referred the doctor here in Manila, and then that doctor diagnosed her as well with ALS.
How long ago was this diagnosis?
When
she had the first signs and symptoms of ALS?
2011, I think that was around April in 2011 when she started to have weakness with her lower legs or lower extremities.
And then 2012 was the final diagnosis?
Yes.
Is that a long period of time, Dr. Paul, Dr. Bimbo, for the diagnosis, about a year, for the disease to progress, so to speak?
It really depends on the initial presentation of the patient. As Leo mentioned, it could be confused with something else like a stroke or another neurologic condition. So it depends on the presentation, but some patients really do suffer a delay before they're eventually diagnosed with ALS.
And by you managing the page, Leo, have you come across others who have loved ones or they themselves have been diagnosed with ALS here in the Philippines?
Yes. Earlier when the Ice Bucket Challenge is not that popular yet, I only met one family with an affected family member. But because of the ALS Ice Bucket Challenge, a lot of Filipinos became aware of the disease. And so I received a lot of feedback, and I was surprised that there are a lot of families as well here in the Philippines who are affected by the disease.
So knowing that there are a lot of families affected by the disease because of the Ice Bucket Challenge, also done here in the Philippines, there's a certain support group already, or there's certain...
there was a proposal for a support group. Most of the families who are affected really wants to have a support group here, like our family as well. That's what we were looking for before. That's why I thought to set up a page to see if there are other family members whom I can reach, and then probably ask for ideas, support, or counseling on how they manage their patients as well. And then eventually probably we can set up a support group here in the Philippines. So right now I'm speaking with other families who are interested in setting up a support group here in the Philippines. It's currently in progress with the help of our doctors as well.
Yes. Dr. Bimbo, support and the help and the understanding of family members, and how nice of Leo to set up a page so that those who are affected or whose family members are affected can run to this support group for now, no? For now, yes.
Yeah, as I was saying earlier, when Paul and I were discussing, I think the best way to help the ALS support group is to collaborate with the Philippine Neurological Association through the Neuromuscular Council. Kasi PNA have different councils, stroke council, epilepsy council, and ALS is under the neuromuscular diseases. So I guess the Neuromuscular Council can meet and with a group of Leo, so we can talk how we can help. Okay.
We'll talk more about how we can help, how the Filipinos can help, no? Those who have been diagnosed with ALS. We'll talk more about ALS when MedTalk returns.
According to the ALS Association, the disease can strike anyone as it cuts across different races, ethnicities, and socio-economic classes. Yet, it is not contagious and cannot spread from person to person in everyday situations.
we're back here on MedTalk, still talking about ALS. This time, doctors and Theo, we have a caller on the line, Jose Martinez. Good evening.
Good evening po.
Good evening.
Opo, good evening po. Ang sakit ko po na lumalabas na degenerative yung cervical spine ko po. Yung 3, 4, 5, 6, 7, and 7. Sira raw, degenerated daw po. Ang ininom ko pong gamot ngayon, puro pain reliever lang. Ang tanong ko lang namamanhid na yung binti ko, yung kamay ko, tapos yung gas pain ko, kinakailangan mag-itaas ko yung kamay ko, itabingi ko yung katawan ko para lumabas yung gas pain ko po, doktor. Yun lang po, yun po na-record.
Okay, maraming salamat sa Dr. Paul. His spine, 5, 6, 7.
Cervical yata.
Cervical, yes.
So, ayon sa kwento niya, mukhang hindi naman ALS yung sakit niya. Most likely, it's a degenerative disease of the spinal cord because of degenerative compression causing spinal cord compression. So, it's a different problem. It's the spinal cord. Yung spinal cord ho, tsaka yung nerve sa spinal cord ho, yung apektado, hindi ho yung mga motor neuron. So, yun ho, yung sakit ninyo na ayon sa kwento niyo, hindi naman ho grabing sakit dahil marami naman hong nagagawa para doon.
Thank you, Dr. Paul. Dr. Bimbo?
Actually, Angel, isa yan sa pinaka-common na differential diagnosis na kailangan naming i-rule out.
Okay.
Pag may nakita kaming suspect ALS, usually, examine namin mabuti, especially kung limited pa lang yung atrophy sa isang kamay o dalawang kamay, titingnan namin ang gulugod spine, cervical spine. Ipapa-X-ray o papa-MRI namin, titingnan namin kung naiipit yung spinal cord. Kasi ang resulta nun, liliit dito, hihina rin ang laman. But the difference is, yung ALS walang sakit, walang manhid. Yung cervical spondylosis, yung sinabi ni Dr. Paul, may sakit at may manhid, dagdag dun sa weakness and atrophy. So, ano na yan, pag makita ng neurologist at merong ganung mga symptoms, malamang hindi ito ALS. Pero cervical spine MRI nila yan. Okay. At kung makita nilang medyo talagang narrowed down na, naiipit na yon, then usually refer to a surgeon, typically a neurosurgeon or an orthopedic surgeon, para paluwagan yung spine, para mabawasan yung pagkaipit. And therefore, maa-arrest mo yung pag-progress ng disease sa spinal cord.
Okay, so for Jose, well, salamat sa pagtawag, Jose. For Jose, he should see what type of doctor again should he see para mas lumuwag yung kanyang the lumbar, no? The lower back, I think this is lower.
In America, ang isang differential diagnosis in the beginning, it may multiple sclerosis, spinal cord, progressive MS, can sometimes mimic also ALS sa umpisa. But you know, the astute neurologist should be able to differentiate between the two. Kasi yung MS, may gamot yun eh. Yung ALS, wala pa sa ngayon.
Wala pa sa ngayon, pero...
But you know, if you remember rickets, di ba, vitamin D, it took 300 years bago na-link pala na ito palang rickets na ito, ng skeletal deformity na nakikita sa mga bata sa England nung araw, is related pala to vitamin D deficiency. So, nung na-correct nila yon, nung nalaman ko anong cause niya, binigay nila yon, sa hand therapy nila, din gumaling ang mga ito. At na-prevent mo na yung mga... So, that's the way science understands. We need to understand first what's really causing. But for now, the advances since 2006, when the Human Genome Project, the gene study, pumutok na ito pala ay related to certain genetic mutations na nagkikreate ng mali doon sa protina sa loob ng nerve cells na nagiging toxic, eventually leading to increase in toxic substances. For example, glutamate. Yung sinasabi ni Dr. Paul kanina na riluzole, anti-glutamate yun eh. But that's only one of the many theories na marami pang ibang theory. Like for example, nakita nila na certain antibiotics, for example, minocycline, saka ceftriaxone. Sa animal studies, nakita nila na it seems to be it helps delay the progression of the disease. So hintayin natin, baka umpisa na yan gawin this human studies. So, doon natin makikita kung nag-work nga ba talaga o hindi.
And a few years down the line, mahahanap na rin natin kung ano yung...
Well, with the ice bucket challenge,
Yes.
magkano na? So, ito yung
I think
pinaka-purpose doon.
100, more than 100 million.
So, hopefully, that will be placed into properly conducted research. Like, for example, I know that they are now conducting adult stem cell study. Not the embryonic,
Okay.
adult stem cell, kasi more ethical.
Okay. So
adult
adult stem cell
treatment, yes.
to aid, to help?
To help to, you know, to make these cell pluripotential. Kunyari, kukuha sila sa skin o sa
Yes.
fat,
Oo.
pababalikin nila yung cell to pluripotential at ilalagay nila doon. And these are now being conducted. I know of some small successful study, but we need more studies.
More studies. And this is in relation, of course, to ALS. no?
Right.
Is ALS preventable? We talk about the diagnosis, we talk about what causes ALS. Is there a way to prevent someone from being diagnosed with this disease? Any lifestyle change, any vitamin we should take, any certain food we should have in our diet?
Well, maybe only for those few cases who have a genetic cause. Maybe in those cases you can predict who will get ALS and maybe you can prevent it. But for the majority of cases, there's really nothing you can do to predict or prevent ALS.
And we're here to educate, no, not to cause any panic.
Yes.
Because sometimes you'd think that when there's cramps, you have difficulty swallowing.
Yeah, everybody sometimes feel may nagka-cramp. So
Yes.
It should be cramp that's more than the usual. Especially pagka yung talagang yung tinatawag na volitional cramping, pagkagabi sila, pag umikot na nagka-cramp na severe, ganun, na madalas. Hindi lang paminsan-minsan. Then,
Every day yan, Doc. Yung mga symptoms na yan.
it's progressive. It's progressive.
Okay.
Hindi yung, kasi minsan,
Nawawala siya
yung nerve
minsan.
cells natin, pagka nagpapalit din, minsan nakakaramdam tayo ng mga twitches. Normal
Yes.
lang yan.
Yes,
Pero
yes,
kung
yes.
medyo humihina, tapos nagtitwitch, tapos parang lumiliit, it's about time na mamating na siya, usually by a neurologist. Yeah.
Leo, in your family, your aunt is the only one who has been diagnosed
That's
with ALS. Is there a certain test that can be given to family members once they find out that a family member or a loved one has ALS?
As I said, only a very small proportion of cases are genetic, so I don't think it's recommended to do any gene testing yet for family members with ALS.
Maybe si Leo, meron siyang page, we don't know yet. But doon sa mga nakikita namin, kadalasan, 90% of ALS are sporadic. Ibig sabihin, hindi natin alam kung sinong tatamaan.
Okay.
Only 5 to 10% yung tinatawag na familial that runs in the family. Kaya nga doon nila naumpisan in-study nila yung mukhang nagkakaroon ng
mutation.
gene mutation. Nalaman nila na mayroon mga synataxin gene, SOD, sumaroxide dismutase gene. Meron pa ng mga ganon na nag-iibang behavior nila na eventually leads to what we call programmed cell death. And isa sa pinaka-latest, hindi lang pala neurons ang involved. Mukhang nakita nila yung isang supporting cells, which we call the astrocytes. And meron pang isang microglia. Nagsisikret sila ng toxins na tinignan nila doon sa culture studies na mukhang ito isa sa mga pumapatay din dun sa
This is recent
neurons.
research, Doctor.
Yeah.
In addition to the research that has been...
So, one of the obvious tinita nila, if you can prevent these astrocytes from releasing those toxins, maybe yan. And then there's another study when they used creatine supplement. Yung creatine.
Yes. For those who work out.
Yes.
Yes.
May study sila, pero animal studies pa lang.
Okay.
Na mukhang it passes the blood-brain barrier, and they don't know how it works, but it helps delay the death of the motor neurons in the spinal cord.
Maybe when you come back next time, we'll have more
and then yung
information
antibiotic,
on
yung
that.
Panderma, minocycline.
Yes.
May mga studies na yan, pero animal studies pa rin din. Hindi pa natin ma-recommend pang humans. So, until we reach that stage ng research na proven talaga.
What should we do?
Safe and effective. That's the time that so far, sa ngayon, isa pa lang ang gamot. Yung anti-glutamate na sinabi niyo po na Riluzole or Riluzole. It used to be here sa Pilipinas.
Yeah, during the break you mentioned that it was marketed here in the country.
But now, for my patients na gusto talaga mag-riluzole, we let them buy in Hong Kong, in Singapore, because they have in the other countries. Yeah.
Okay.
It's available naman.
It's available naman and readily available to those who need it. Leo, anything you'd like to add or would you like to share with us the page for more support from our viewers?
Sure. Well, first of all, coming from a family who has an affected family member, we really appreciate the support coming from all people. And I would like to encourage our fellow Filipinos to see the ALS Philippines page on Facebook and see how greatly affected we are on this issue. The disease may be rare and there might be a few cases here in the Philippines, but these people are no different to those people who are in need. So we really need support, not just for the research, but other needs like to sustain support for our family members. So you can check the Facebook page for updates.
Okay, what's the exact?
It's facebook.com/ALS Phil, FHIL, or just simply search ALS Philippines.
Okay, thank you very much, Leo. Thank you for sharing your story as well with all of us. Dr. Paul, any last message to all our viewers?
Well, we're happy about the attention that's been brought to ALS because of the Ice Bucket Challenge. But we know that there's still a lot of work to be done. And we're happy to know that there's a support group existing. So I think we can work with them. So we really need to bring attention to this condition, and having cooperation between our doctors and with our patient support groups would really be a big step toward bringing attention to ALS.
Thank you very much, Dr. Paul. Dr. Bimbo?
I think the world is now the eyes, the ears, and the ALS. But my thinking is this, we should not only think globally in terms of we have already increased the awareness of what is ALS, but also act locally. Help our own Filipino patients with ALS by, as I'm very proud that Leo has started that, and as I said, I would encourage Philippine Neurological Association through the Neuromuscular Council to see what we can do with regards to this. Okay, so.
Well, thank you
very
much.
Thank you also for having us here.
Thank you. Thank you, and we're happy that you've come to educate all of us on ALS, the awareness. Starting today, we're more aware, and we'd like to give our support as well to the ALS Foundation and to all the other diseases that our Filipinos face. You know, we should all support them and be well educated on how to help and prevent all these diseases as well. Maraming salamat sa inyong tatlo. We'll see you again next Tuesday, 7 p.m. here on your scheduled on-air consultation on 9TV. You're watching MedTalk. This is Angel Jacob. Good night.
Also degenerates. So it's actually a combined degeneration of the upper motor neuron coming from the brain, yung pinaka-boss that tells our muscles to move, and then tells the neurons in the spinal cord, the lower motor neuron, both of them degenerates eventually. They die gradually, progressively, leading to weakness of the muscle and wasting, atrophy, fasciculation. Eventually affecting the ability to speak, to talk, to write, to use your hands, to walk. And later on, they become bed-bound, wheelchair-bound, and then bed-bound.
So just with that information, it's overwhelming to understand and to absorb what happens to our body once one is diagnosed with ALS. As you've mentioned, the muscles degenerate, and so does the nerves Isn't that right, Dr. Paul?
Yeah, it's the nerves that degenerate first, the motor neurons that die down first, and then later on, because it's the neurons from...
ng katawan, usually asymmetric or yung hindi pantay yung pagliit ng isang bahagi ng katawan. At ito ay walang kasamang sakit, hindi kayo makakaramdam ng pamamanhid, so panghihina lang talaga.
It usually affects people between the ages of 40 and 70, with various early signs and symptoms that include weakness in the feet, hands and legs, twitching, muscle cramps, and difficulty in walking and doing other regular activities.
As of now, wala pa pong cure for ALS. Pero we don't really talk about cure. We talk about management.
There is currently no cure for ALS, but the recent support by people all over the world through the Ice Bucket Challenge, together with other initiatives, have been big and important steps for people to know more about this debilitating disease.
How common is ALS in the Philippines? How is ALS diagnosed? Find out the answer. This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
By now, you may have already heard of the ALS Ice Bucket Challenge, a viral philanthropic social media campaign that involves dumping a bucket of ice water on someone's head to raise awareness about the disease, amyotrophic lateral sclerosis. This widely popular activity encourages donations for research of the disease, with many big names joining the fray, such as LeBron James, Justin Bieber, Bill Gates, among many others.
ALS is amyotrophic lateral sclerosis. Amyotrophic meaning lumiliit yung mga muscles natin, nagkakaroon ng atrophy. And lateral sclerosis means it's affecting a specific part of the spinal cord. Isang term dun sa ALS is called motor neuron disease.
ALS is a progressive neurodegenerative disease that affects nerve cells in the brain and the spinal cord and can lead to total paralysis.
Ang unang-unang mararamdaman ng mga tao is panghihina. Panghihina dun sa iba-ibang parte ng katawan. Maaring nahihirapan sila sa paglalakad, madaling madapa, napapansin nila na lumiliit yung isang bahagi.
Tonight on MedTalk. And joining us tonight is Dr. Paul Pasco, neurologist of the Philippine Neurological Association of the Philippine General Hospital, Department of Neurosciences. Also with us is Dr. Alejandro Diaz, consultant neurologist at the St. Luke's Medical Center, UST Hospital, and San Juan de Dios Hospital. He's also a member of the Neuromuscular Council of the Philippine Neurological Association. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Bimbo, Dr. Paul. Welcome to MedTalk.
Good evening, Jake.
ALS.
Angel.
Yes,
Yeah.
doctor. ALS, amyotrophic lateral sclerosis. What is ALS? Let's start with you, Dr. Bimbo.
Yeah, ALS or amyotrophic lateral sclerosis, meaning to say amyotrophic, lumiliit yung muscle. Eventually, gradual progressive wasting and weakness of the muscle. And then lateral sclerosis, because that part of the spinal cord, which we call the corticospinal tract, coming from the upper motor neuron from the brain,